first and foremost, the best way to prevent the influenza is to get vaccinated. Once you get vaccinated, the other most important way to keep yourself from getting infected with influenza or for most of other types of infections is to do good hand washing. Anytime you come from outside or come back from school or from work, it's always a good idea to make sure you do meticulous hand washing. Or if you've been around anybody who appeared to be sick, that's another good opportunity to practice hand washing to prevent any transmission from happening. The most popular technique we try to teach families and children is to sing the ABC song. And so we try to educate families and children to perform their hand washing and sing the song and stop once they reach the end of the song. But in general, there's no specific soap types or that we don't necessarily recommend. And alcohol sanitizers are also very effective for preventing flu and most other types of infections in general. So this year's vaccine is actually going to be the same as last year's vaccine in terms of the strains that are covered. There are actually two types of vaccines available this year. There's the trivalent and the quadrivalent vaccines. So the trivalent has coverage for 3 strains, and the quadrivalent has 4 strain coverage. But the trivalent vaccine still covers the same strains that we covered last season, which is 2 A-type influenzas, including the H1N1, and then 1 influenza B. The quadrivalent, the 4 strain type, adds an extra influenza B coverage to the vaccine. One of the main reasons we focus a lot on, especially school-age children, is that a lot of these outbreaks or transmissions tend to happen in closed, crowded environments, and school environment is a very vulnerable environment in terms of transmission happening rapidly and spreading widely. Anytime you start seeing some of the symptoms that could be consistent with flu, such as fevers, body aches, muscle aches, sometimes it may be accompanied by nausea and vomiting and other gastrointestinal symptoms, the first thing you probably should do is contact your pediatrician and to get their advice immediately of whether your child needs to be seen right away or whether you can just watch and see how your child is at home. But I would highly recommend, especially during flu season, to talk with your pediatrician in those scenarios.